Hi, how are you?
Good, good, good. Thank you.
Where are you?
Well, I think you recognize, or you would. Let's see here.
Oh my goodness. That's right. They did tell me that you were coming to visit.
Yes.
Are you still going to be there Saturday?
Unfortunately not. I leave on Friday. I have to go to New York. I'm lecturing at Fran Drescher's Cancer Master Summit
Okay. All
on
right. Well, let me
Saturday.
see if I can fix my schedule to pop up there before Friday and see you then.
That'd be great. Thursday, I have to go up to Irvine.
Okay.
Well, I'm speaking for a functional forum, but
Awesome.
tomorrow I'm here all day and all night.
Okay. Okay. Let me see what I can do.
Oh, that would be great.
Yes, it would be good to see you in person.
All right, folks, we're live.
We're live. We're live. Hello, everyone. It is Tuesday, 4 o'clock Pacific, 5 o'clock in Costa Rica, but I'm not in Costa Rica. I'm in the Pacific time zone now. 7 o'clock on the East Coast, midnight in Dublin and London, 1 a.m. in the rest of Europe, 4:30 a.m. Wednesday morning in New Delhi, India, 8:30 Wednesday morning in Australia, 1:30 in the afternoon in New Zealand, and it's Facebook Live. And I think I have those times right by memory. I don't have my phone with me to be sure, but I think that's right. But hello, everyone. It's nice to be with you. Very nice. And we have a very special guest today, my friend, Dr. Aimee Apigian. And am I saying that correctly? Apigian?
Apigian. It's close enough.
Apigian. Thank you. Apigian. Thank you. And Dr. Aimee and I have been friends for many, many years, and she has an event coming up that we're going to talk about. And her area of expertise, well, let me read her description so I get it right. Feeling overwhelmed, exhausted, and on edge? Are you struggling with relationships, unable to connect, or always avoiding conflict? Perhaps you're dealing with chronic health issues like chronic pain, autoimmune conditions, or digestive issues. These are not just random occurrences. These are physical manifestations of trauma. The Biology of Trauma Summit 3.0 and explore the trauma-disease connection with experts guiding your journey towards healing and freedom. And we'll post the link in here for this. It's a summit that aims to empower you. It'll provide you with the tools, resources, and safe space you need to acknowledge trauma and work towards a more resilient, healthier you. Dr. Aimee's a former foster mom, adoptive mom, and a general surgery resident, double board certified physician in preventive medicine and addiction medicine with a double master's in biochemistry and public health. She qualifies as a geek. And she now bridges
right
the
along
world.
with you.
I do. I'm with pride. I do. And she bridges the worlds of functional medicine, neuroscience, and trauma, and works to create online educational and experiential programs for individuals around the world to accelerate their trauma healing journey and teach professionals through her certificate training program how to do the same for their clients and patients. You can find her on YouTube, Instagram. Her website is traumahealingaccelerated.com. So Dr. Aimee, welcome.
Thank you, Dr. Tom. It's always good to be here. And
Yes.
You are one of the experts on the summit, and we talked about predictive autoimmunity, such an important piece of this downstream effect of trauma. We know that from the studies. So I'm so honored to have you speak on the summit.
Oh, thank you. It was fun. It was fun to do it too. So there are some people in the world, and I'd probably guess to say a majority of people that have no clue whatsoever what past trauma might have to do with their health. I think most of us live in a world of I'm fine, and it takes some awakening to recognize that, wow, there's something, my steering wheel keeps pulling to the right and I'm turning my steering wheel to the left to go straight. There's something wrong with my car. that it takes a while before people realize this. So how do we introduce this concept of past trauma affects health, current health? How do we introduce that concept?
That's a great question. And even in my own life, that was actually a big obstacle that I had to overcome, Dr. Tom, because when I looked back at my childhood, I did not see trauma. I mean, I was a foster parent and then adopted Miguel. And when I looked at his background, I clearly saw trauma. And so I think really compared to his background, when I looked at my background, I'm like, I've had it good compared to him. So when I started having health symptoms, chronic health issues, I knew from my studies that they were related to adverse childhood experiences. Those were some studies that actually begin in the 1980s, but first were published in the 1990s around this idea that we don't know why yet, but trauma in childhood is associated with all of these adult diseases that were chronic diseases. And when I saw that that was happening in my body, that's when I realized, oh, like, I think I've misunderstood maybe what trauma is, or maybe I've been trying to define it in a box, and I need to have a new definition of it so that for me, really the conversation actually doesn't start around trauma, because many people don't relate to having had trauma. Like you say, they're like, I'm fine. I survived. I'm here. So what's the problem? And right. Being able to just focus on, can I just keep the focus on my symptoms rather than perhaps the not understanding the life experiences that shaped our biology that's driving our symptoms and even the development of chronic diseases like autoimmunity, but so many others.
Right. So let's do not a deep dive, because people will start thinking about dinner if we do a deep dive, but kind of on the surface a little bit. We'll use me as an example, I guess.
Let's do it.
I grew up in a middle-class family in Detroit. Always had everything that we could ask for. I went to a parochial school. My brother and I went to parochial school. My dad always worked very hard to support the family. He was a firefighter, and firefighters don't make a lot of money, but he always worked another job and sometimes two other jobs while he was a firefighter, so that he could afford to pay tuition for a parochial school. I mean, he really worked hard for that. And my dad was a World War II guy, and came home, and after a hard day at work, he'd have a beer or something and watch television. And my family never talked about feelings ever. That wasn't a concept you talk about. So, but on the surface, it looked like, it was a healthy family, a good middle American class family. But when I got to be an adult, and in my first marriage, I was married to a social worker who became a Jungian analyst. And so I started hearing about all of these correlations between perceived trauma. I would say perceived trauma. As a child, it may have seemed traumatic, the energy of my father saying, "What did you say to your mother?" Or something like that, that it was perceived trauma for a child. But those experiences at the childhood level of safety, the feelings that they had, the threat to their survival in terms of the energy that was coming at them, I learned that I was carrying some defense mechanisms of how I respond to my everyday life now as an adult. And we traced it back to those kinds of events that happened to me as a child. And that was again and again and again. I just kept learning this, and it just shocked me to learn this. And how common is it that people have these kinds of experiences as a child. It wasn't sexual abuse or it wasn't being beaten up. But how common is it that from a child's view, there were numerous traumatic events that they were experiencing?
The stories that come in from people who are either going through my program or they decide to have a biology of trauma health coaching session, the stories, Dr. Tom. And for me, that's always what brings it home is a story similar to yours where my childhood was relatively good. Like, who am I to complain? And there's one particular that stands out from kind of hearing your experience. And this was a lady who, again, had a great upbringing. And she remembers that her father later told her that the day that they brought her home from the hospital, he realized he had married the wrong woman.
Whoa.
Right? Like just with that, you can imagine the dynamics that would have changed. And this would have been when she was a newborn. So she wasn't even aware of this. This was just the environment, the unspoken environment that would have likely made her mother start to feel alone because she probably felt that distance from the husband who realized, oh, I married the wrong woman. So now the mother is in overwhelm and she's passing that on to her child because she's now consumed in her thoughts and trying to figure things out and perhaps experiencing some depression. And so the attunement even isn't there that a baby needs. And so a baby then starts to feel all alone because I'm trying to connect with this adult, but they seem to be in their own thoughts.
Right.
We can even look at something like the cry it out principles for parenting that were at one point, right? Where the idea.
Can we stay with that example?
Sure. Yeah.
So what were the symptoms that this person came to you with as an adult that you traced back there? What was it that brought her to you?
She was having chronic fatigue, had not been diagnosed with it, but was experiencing fatigue, low energy, and IBS and autoimmunity.
Yeah.
Are you surprised?
Not at all.
Not at all, right? Like it's actually predictable that these are the kinds of health issues that result, especially like you were talking about, the earlier that these experiences happen in childhood, the more it sets our biology to go in that direction towards disease, even though that disease does not surface until adulthood, possibly.
You know, the primary first aspect of the immune system trying to protect us from foreign invaders, and most of those come in through the mouth and what we eat. The first immune system component is called secretory IgA. And you know, of course, but for our audience, secretory IgA is a sponge that any bad bugs, they get attracted and the secretory IgA just grabs them. It grabs them and then the bug can't get loose as it's going down the intestinal tract. It can't get loose to grab onto the inside walls of the intestines. Secretory IgA is holding on to it and escorts it out in the poop. And that's a very, very important aspect of our immune system that's working every single day for us in our lives. And it was Dr. Joe Dispenza in his book, Becoming Supernatural, where he quoted the study. You spend, I think it was 9 minutes a day, 9 minutes, three times a day, 9 minutes, 3 times a day for 4 weeks, 9 minutes. And you just sit down, close your eyes, think about gratitude. What are you grateful for? What are you grateful for? And where can you envision your future going? And who has expressed love to you, or who are you expressing love to? And just a few basic things. You close your eyes for 9 minutes, set your alarm, do it 3 times. And in a few weeks, you've increased secretory IgA by 64%. That many more cells just by calming yourself down and envisioning something positive 3 times a day, 9 minutes. So it's a total of 18 minutes a day. And you have increased the primary and first defense, kind of the lookout posts, that are looking to see if anyone's trying to sneak in. You increase them by 64%. That is quite remarkable.
Yeah, the research coming out of trauma work, and that's maybe what I'll just call it is trauma work, is actually what's the most important thing is exactly what you're describing. It's called state regulation. And are we actually shifting our own state out of fear, out of constriction, into openness and gratitude? Can we learn how to shift ourselves? Because that is the most important factor for our physical health and our physical health symptoms. This is the same data that I'm getting from my program, where for 21 days, they do a 10-minute somatic exercise that is connecting to their body, but learning how to shift their state. And in just those 21 days, they're experiencing 26% decrease in daily physical pain, 28% decrease in GI symptoms, 30% decrease in fatigue, 30% decrease in sleep issues, not to mention the decrease in anxiety and depression. And it's this element that you're talking about, Dr. Tom. It's being able to actually learn how to shift our own state has more influence over our physical health symptoms than any single supplement that we could take.
Yes, that makes so much sense. And it's not hard to do. It's not rocket science. It's pretty easy to do, right?
I would call it simple. I wouldn't call it easy, Dr. Tom.
Good point. Good point. Yeah. Simple, not easy, but
simple. Not easy. For if you've always lived in fear, it actually is hard to move to a place to gratitude. It's an unfamiliar place for you. It doesn't actually feel safe to open up. It doesn't feel safe, to relax, to calm down. Yeah. You're built for, I can't let my guard down. Something might happen if I let my guard down. And so it actually doesn't feel safe to let our guard down. And that's where we need to start with baby steps into this ability to regulate our own state, but do it baby steps at a time, because our body is so convinced that it needs to stay braced and guarded in order to survive. It's fascinating.
Feel free, audience, to ask some questions of Dr. Aimee while she's here. This is your opportunity. You've got full focused attention of one of the experts in the world on trauma and the long-term effects of trauma. So a good friend of mine lost her husband recently. They had been married for 1 year. It was a second marriage for her, and she had a 2-year-old son when they met, 3 when they got married, and he's 4 now. So the son was from the first marriage, but the boy had just started referring to him as dad, that they had great interactions together, just wonderful. A lot of laughing, a lot of giggling, a lot of playfulness. And he put his son to bed one night, gave him a kiss goodnight, left the room, closed the door, and fell over dead in the hallway at 48 years old. This happened a couple of weeks ago. And that's why I'm in San Diego right now. The service was a couple of days ago. And obviously, there's very little that's more traumatic than that. There are some things, that could be, but that's as traumatic as trauma can be. And had dinner with her last night, and she was in such a good place because she's acknowledging the fear that sometimes goes to panic of what's going to happen in my future, our future, the sadness, the extreme loss, the recognizing that this feeling doesn't go away. And I validated her because when I lost my father suddenly, unexpectedly. A year later, I'd have moments, all of a sudden, tears are running down my cheeks, and I didn't know what was going on. I realized, oh, I was thinking about my dad. And I'd be working on a patient sometimes, and they're laying on the table face down, and I'd see wet stains on the back of their shirt. And I realized it was my tears. And that's when I realized, oh, I'm crying. And, but that just happened. And when my friend is talking about this, she's recognizing it. She understands this. And although she can never understand what she refers to as God's bigger purpose, she accepts that this is what's happened, and somehow we're going to move forward. But she doesn't want to try to put icing on a bad cake. So she's just observing her feelings, talking with close friends about what's coming up for her, sometimes being alone. Just went to a very expensive spa for 3 days where they did massages on her and manicures and pedicures and all of that. And everyone knew of the story and was sympathetic. But I think this is the healthiest experience of trauma I've ever seen. That it's fresh, it's new, and because she's done a lot of work to understand her inner dynamics and how her personality operates in life, what her operating manual is, I guess, if I could say it that way. And is that something that gets addressed when people are working with you, as an example? Is that you're observing and then pointing out what operating manual they currently have?
That's exactly it. And that's where we need to start. And it's interesting that as we start with what I call becoming a compassionate witness to our body.
Yeah.
That maybe for the first time, we're actually listening, we're actually feeling those sensations that come up in our body rather than pushing them down, stuffing them down, maybe emotionally eating them down, whatever it is that we've used to get through. Then as we start to actually allow those sensations to surface, that's where some people can get stuck because they're so uncomfortable with feeling the loss. They're so uncomfortable with the grief that always comes up with trauma work. Maybe they're uncomfortable with anger. Maybe when they grew up, actually expressing anger, having conflict was not allowed at all. And so that is a block for them, that they can't allow themselves to even feel anger surfacing, and they have to shove it back down. And so the more that we can actually, what I call, become comfortable with the uncomfortable.
Yeah.
And what it sounds like your friend has been able to do is allow the uncomfortableness to be there, but it not take her into a place of unmanageable, where she's spiraling out of control. Because that's the trauma place.
She's not spiraling. Now she has moments where she really can't function very well. Right. And so she just goes in the bedroom and sits down and cries, or, but just allows herself to be there and not run into altering her consciousness with alcohol or drugs or anything. Yeah. But she just allows herself to be there because she knows there's a process to deal with this. Yeah. And she knows what's on the other side. Here's a question that came in from Colin, and I believe this is our Colin from Great Britain, who is with us almost every week, but I think that's him, and it's just Colin on Facebook, what I see here. And he says, years ago, trauma was considered something that you accepted and lived with. Even today, many believe that trauma is something that you have to get over. You never get over it. You just learn how to integrate it a little more into your life. That would be my response to that. In 1974, after 3 years of happy marriage, my wife was involved in a car accident. She seemed to recover for 1 month, but then started getting headaches. To cut it short, she seemed to have an operation. She needed to have an operation to remove a blood clot in her brain. She was left in a coma and died 5 days later. I suffered physical and mental issues for the next several years, but to this day, I believe that many of my present symptoms at 74 still relate back to that incident. Dr. Aimee, what would you say about that with colon?
There's so much that I would like to say. So as you have guided me to give the overview, that's what I will do in this case. And what I'd like to say is that just like we have had this saying that, oh, kids are resilient. Kids are not resilient.
Yeah.
Kids are absorbing all of their life experiences. And unless we as adults teach them how to move through experiences that are challenging and difficult and overwhelming, that all becomes stuck in their body and it becomes their disease. Same thing with us as adults, that we're still in the same body. And so unless we have learned how to move through our experiences, then it becomes stuck in our body, and our bodies are not resilient. Our bodies, that's actually one of the aspects of our nervous system, is that there's this neuroplastic ability, and it adapts. It adapts to our world. It adapts to our experiences. And so in that adaptation, lasting changes happen in our biology. Now we can undo that damage, again, learning through how to move through these experiences and then being able to address the chronic changes in our biology, likely inflammation being one of them, oxidative stress being another. There are these consequences from long-term trauma that's been stuck in the body that we haven't been able to move through. So we need to address that biology, but also learn how to integrate it. One of the things that I will say is what I've learned about trauma is that when we're looking at, say, an event, which trauma is not an event, trauma is our experience in the event, which is why two people can go through the same experience and one walks away having PTSD or chronic problems. And another person was like, whew, that was hard, but they seem to bounce back and are fine. So it's not the event itself. It's actually just our body's experience, our body's response, our body's relationship to that experience. And
now, is that concept elaborated on in the book, Zebras Don't Get Ulcers?
No. So the Zebras Don't Get Ulcers is more about stress and being able to move through a stress response, but that's not a trauma response. But the same concept does apply, that we can actually move through and complete a trauma response. And that's where people, like, we just haven't been taught how to do that. Like Colin says, what we've been taught is that you suck it up. You keep going. There's not this idea of, let me complete it. And you see a lot of this completion, maybe in some of the tribes, in some of the shamans, in some of this Native American type of thing, where they actually have ceremonies after someone has passed. It's a whole completion of a cycle. And with most of our Western society, there is no completion. It's just like an event happens and you're expected to somehow keep going and go to work the next day and continue on as if nothing happened. And that's where the body feels a shock, but it doesn't get the resolution that it needs to move through and process the shock. There's this aspect then of what is our state, what is our nervous system going into an event or a life experience, because our response to a specific event, whether that is a loss or that's a natural disaster, or whatever it is, it really doesn't matter. But our state going into that is the biggest determining factor for whether that will become a trauma for us or just a stress.
Oh, interesting. Really interesting.
And so this is where we can look at, well, we really do need to look at your childhood. No, we don't need to blame your parents. That's not where we're going. But we need to look at, in your childhood, did you already have events? Did you already have experiences where you felt alone, where you felt overwhelmed, where you felt lost, where you felt like, I don't know if I'm going to be okay, and I feel stuck. Those are the experiences that we're looking at. And the more that you had of those types of experiences in your childhood, the more you are set up for life to experience all subsequent life events as a trauma, because your system is still dealing with all the unprocessed experiences from childhood that it got stuck with. And so
yeah, and I'd like just to
Yeah.
reinforce what you're saying, that you said stuck for life. That is only if you don't become conscious of it. Because if you
Exactly.
work on it and you become conscious of this dynamic that's occurring inside of you, you now have choices
Yes,
and how to respond. Yes.
exactly. And that's the beauty, that's the promise of actually starting to become conscious and learn how to work through this, learn how to move your state from that state of overwhelm to one of gratitude. Because it's when we can learn to do that, that it opens up the possibilities, and it frees us to then have choices. It frees us to have a very different body and health, both mental, emotional, and physical health. And so that's the promise, right? That if you do this work, like, this is what is possible. There's no shame if you don't want to do the work, because it is hard and it can be scary to feel into things that you haven't wanted to feel. That's why it got stuck, right? Because it felt
Right.
so big and so hard at the time. We didn't want to feel it. But on the other side, Dr. Tom, like, on the other side is just so much life and connection
Yeah.
and joy,
Yeah.
right? Like, and that's what
Yeah.
you've stepped into with your life, which has been absolutely beautiful to watch as well.
Oh, thank you. Thank you. Well, there was a lot of steps to take to get here. A lot of steps, lots of trauma early in life, growing up in Detroit. But so Robert's on Zoom and he has a question. Can you say something about a relationship between ego strength and mitochondrial dysfunction?
Great question. So when we look at the actual trauma response in the body, what we've been taught is that it's an emotional or psychological response, which means that it's an emotional or psychological problem and you need to go talk about it with a therapist. And actually, what we have learned since then is quite the opposite. The body's response is a physiological one. And what happens is that we have a nerve in our body called the vagus nerve. And this is the nerve that will either communicate connection, curiosity, gratitude, openness, or what will travel down that nerve and communicate to all the cells in our body is overwhelm and shut down to conserve energy, basically constrict, hibernate, go, like shut down. And so that vagus nerve, the vagus nerve is just the highway, right? It really matters like what cars are driving down the highway. So the vagus nerve is just the highway. And when that trauma response gets triggered, which gets triggered either by a experience of too much too fast or too little for too long, too little of support, too little of love, too little of nurture, too little for too long, we just can't keep going. So if one of those triggers happens, our body then goes into a trauma response, which means that the cars driving down that vagus nerve turn to these black cars that tell everything to shut down, including our mitochondria. So our mitochondria now go into this energy conservation state. And that's why when people are in this trauma response, we also call it the freeze response, because we can feel frozen inside, paralyzed inside. When that happens, our mitochondria get shifted into make as little energy as possible, expend as little energy as possible. This is not the time to go big or go home. This is the time to go small to stay safe. But that communication is happening even on the mitochondrial level. And what starts to happen is that more oxidative stress starts accumulating not only around our cells, but inside of our cells around that mitochondria where it's supposed to be making the ATP. And in the process, it makes waste, oxidative stress. But the trauma response, because we're going into energy conservation, it's turned down even our clearing out system and our detoxification system. And so all of this damage also starts to accumulate, which will cause further inefficiencies in our mitochondria. So when we look at the trauma response, this is actually an energy problem. The trauma response is both a response to I don't feel like I have enough energy to meet this problem in my life. And it will cause an energy problem because of its effects on the mitochondria. And then we could talk about all the effects even on the DNA and the extracellular matrix and all of the other systems involved. But specifically for the mitochondria, that is what happens in a trauma response to the mitochondria specifically.
Stanley's on Zoom and it says, I purchased the 3.0 conference. Will you be covering EMDR for healing from trauma? Any thoughts on that type of therapy modality? I'm a combat veteran, 100% disabled.
Great question. In this summit, I am not covering that specific topic of EMDR, and here is why. EMDR is a modality that works with our brain and some of the memories that are stored in our brain, and it accesses those through movements in our eyes. So it's eye movement, kind of depotentiation, and trying to take the charge out of memories through different movements of our eyes. And what you will discover in this summit is a specific lens that tells us how we should do trauma work. Not just that we should do trauma work. I think most of us here know that, especially if you're listening to Dr. Tom, you know that, but it's how do we do it? There's a way in which we need to approach it because our bodies are amazing machines. And yet at the same time, they are absorbing life experiences. And so there's a certain sequence in which we need to approach things in order to help the body do it in a safe way. And where we have to start is informed by what we call the polyvagal lens. This is a fancy word for what was actually discovered from research in the NICU with preterm babies, Dr. Tom. And what they discovered was working with preterm babies. These are babies who don't have their nervous system fully developed when they're born. They're preterm. And what they found was that they have this strong mechanism of self-protection and shutting down their physiology when their physiology is amping up, and they might die because their heart rate is going too fast or their lungs are breathing too fast. And so they have, we, all of us have this inbuilt mechanism that is regulating our physiology every moment of the time. And so in a trauma response, that's what turns on is this self-protection mechanism. That's what then travels down the vagus nerve. So polyvagal refers to there's different messages that can travel down that vagus nerve. It's not just the vagus nerve that we need to know about. And so as we look at that, we get informed of how to do the trauma work. And the place to start is becoming connected with our body, what we call that safe, compassionate witness to our body, but learning how to shift or regulate our own states. And the EMDR is not a modality that will teach you that. This is a modality that you need to go in and see a therapist for that. And what I have found is that just like Dr. Dispenza wrote in his book, 9 minutes, 3 times a day, you need skills that you can do for yourself so that you're doing something all throughout the day, not just once a week when you go and see a therapist. That's not the kind of consistency that our nervous system needs to really be able to affect change. And without that stability, and I would say that the ability to regulate our state and go into a place of gratitude on our own is what allows then for the stability and the foundation for us to do some of these other modalities when we are ready. And so that would be how I see EMDR is it's not the place to start. It's the place it's something to bring in after we've laid the foundation of actually learning to connect and shift our own states, but keep things manageable, Dr. Tom, right? Like, just like you said, right? Like we need to
build the foundation, and then support it.
And then support it.
Right.
Yes.
Marvelous answer. Thank you for that. Thank you. Anonymous on Zoom. Anonymous comes every week. And Anonymous, it's nice to meet you, Anonymous, or nice to have you here again. Hi, now I'm 75 years old. At age 6, I had head concussion. Now I have IBS, had a meningioma. Could it be trauma? Did all of it? Thank you.
Oh, thank you, Anonymous, for the question. So this brings in an additional element to the picture of trauma that I'm glad you're bringing it up. And I'm also sorry that this has been your experience.
Yeah.
When we look at what happens in the body in response, in a trauma response, brain inflammation is part of that equation. And the brain inflammation, how you will know that your brain has gone into that place is that you'll feel like brain fog. You'll have a hard time thinking clearly. It'll take you longer just to get your stuff done because it's taking you longer time to be able to focus. You forget things. You don't remember where you put your glasses or your keys, or the brain is just not working as well. So these are common symptoms of brain inflammation, but here's its connection with the trauma. The brain inflammation by itself from a physical head injury that we've had in our life, the brain inflammation, when it is activated, when it's triggered by other exposures that we go through, it will actually cause a trauma response in our body that has nothing to do with anything emotional. It's just the brain inflammation got reactivated.
Wow.
So
yeah.
I'm sure, Dr. Tom, you talk about the microglia and primed microglia and how this happens in head injuries of any kind, even down to just a simple whiplash. We can still have primed microglia from that. And for example, once we have primed microglia, if we don't sleep well one night, or if we are eating a food that we're sensitive to, these are all things that will reactivate those primed microglia now, causing a cascade of inflammation in the brain, but that inflammation will trigger a trauma response in the nervous system and in the body. Had nothing to do with the phone call that you just had nothing to do with the conversation that you had with your friend, has nothing to do with work necessarily. It was just that brain inflammation that triggered the freeze response. And when our body does go into that freeze or trauma response, it will trigger brain inflammation. So those two things go so closely together that for me in my programs, that brain inflammation is an essential piece that we learn how to support in order to better support our body in moving through and processing traumas and coming out of that state.
One of the things we emphasize in terms of brain dysfunction is how much inflammation do you have? And the test that we recommend for that is called the NeuroZoomer Plus, which looks at 56 antibodies to your brain. So if you have 3 or 4 elevated, that's a big deal. That means, yeah, there's inflammation in your brain right now. And so you apply your therapies, whatever your therapies are, you apply the therapies that you've chosen to do, you wait 6 months, and then you check again. And you keep doing that blood test every 6 months until it comes back normal. So meaning no elevated antibodies, no more markers of brain inflammation. And what exercises you do? Well, Dr. Aimee's already referred to a couple of them, and in her summit, masterclass summit, I'm sure you're going to have more of the protocols to follow.
Yeah, that brain inflammation is a big piece. And even understanding that once we have had a head injury, emotional things will trigger that brain inflammation, and it's less emotional stress that will trigger. So if you haven't had a head injury, you can maybe experience something emotional and not have it trigger brain inflammation. But once you have that primed microglia from a prior head injury, your brain, your nervous system is just more sensitive. And so even things like emotional stress can re-trigger and reactivate brain inflammation. So it's a big deal, and learn how to support it.
Lorna on Facebook says, much gratitude to you both for sharing your knowledge and time with us all. Fantastic conversation. You have both given me so much advice. My life and health has improved. Well, thank you, Lorna. That's very kind of you. Colin is back and he says, yes, Dr. Tom, is Colin from the UK. Dr. Aimee is right. There was no help for those experiencing trauma. There seems so much more on offer in the present day. Yeah, very true, very true. Like this summit and listening to the experts on that, talking about that summit. Cynthia's on Facebook and she says, this type of work has helped me in my healing journey profoundly. Grateful for Dr. Aimee's work. Thank you, Cynthia. Thank you for the comment. Sophia says, please, is hyperventilation and anxiety reversible? My brother suffers from heart angina due to his hypertension. Thank you.
This is a big one.
Yes, it is.
One of the things that I teach is the difference between stress and trauma in the body. And so there is a stress response and stress physiology that the body goes into. That would be your typical anxiety, where if you truly are in a stress response, you actually have a higher amount of energy. This would be if you are perhaps maybe your dad, Dr. Tom, as there was a call that came in for a fire, his body would go into the stress response. He would experience higher levels of energy than what he had just had, and he would rush towards the fire to deal with the problem.
Right.
So there is a stress response that is high energy. This is where a mom can lift the car off of her child who's pinned underneath. Will never be able to do that again, has never been able to do that in the gym, right? But the stress response and the adrenaline that comes with that is actually something that gives us high energy. So if that's the anxiety that you're talking about, well, yes, we can learn how to move through the stress response and actually help the body come back into what we call the parasympathetic state, rest and digest, social engagement, that what I call calm aliveness. All of that, we can teach the body how to move through a stress response because it can get stuck there. But if we're talking about a trauma response, many people who describe anxiety are actually describing a trauma response, and our bodies can get stuck in a chronic trauma response. This is a what we call a functional trauma response or a functional freeze response, where they're still going through life. They still have a job, they still have work, they're still getting things done, but their body is constantly in a state of feeling overwhelmed. And so they describe anxiety, but they're not describing the high energy of the stress response. They're actually describing the heaviness and the overwhelm and that lower energy of the trauma response. And the trauma response is what is associated with the metabolic diseases like hypertension. So it's not actually the acute stress response, like the zebra who has the lion and it runs off and then it's able to complete that. We're not talking about that kind of stress. That's not going to cause hypertension. What causes hypertension is the body going into this chronic trauma response and it shutting down our metabolism. It's shutting down our mitochondria. It's shutting down our detoxification system. It's changing our immune system. And all of those are things that contribute then to hypertension, chronic heart problems, all of our chronic diseases. I mean, I would say 100%, maybe Dr. Tom, you'd say 99% of the chronic diseases have an immune or inflammation component to them. And those are related to the trauma response, not actually the stress response. So
that's a
no
very
matter
good
what,
differentiation.
no matter what, even if we're working with the trauma response, the stress response, wherever the anxiety is coming from, whatever the source of it, like there is so much hope. And that's why we're here to share
Yes.
that there is so much that we can do. We know so much more than what we used to, and even knowing how to do the work and where to start with working with the body, even if it's been decades living like this. There's so much that the body can still undo damage and respond to.
Right. It doesn't matter when you start, you never are beyond the point of slowing down, arresting, and reversing disease. Never. One study showed that if you were to move in the direction of a healthy, away from the standard American diet to a healthy Mediterranean style diet in your 20s, you add over 8 years to your life if you're a woman, and over 11 years to your life as if you're a man. If you move towards a healthy Mediterranean style diet in your 60s, meaning you've had 60 years of lousy diets, The increase in lifespan for men, 7 years. The increase in lifespan for women, 5 years. If you begin a healthy Mediterranean diet in your 80s, meaning a full life of standard American diet garbage, but in your 80s you start, you get almost 3 years of extra quality of life if you're a man, excuse me. And I think it was 4.5 years if you're a woman. It's never too late, ever.
Never too late.
Yeah, that's the important point of that study. And Sophia, to your question, yes, hyperventilation and anxiety is reversible. Yes. Now, to give you a larger picture of this, I recommend we think about health problems and addressing health problems from the point of view of a pyramid. A pyramid has 4 sides to it. And people say, no, there's only 3 sides to a pyramid. No, there's also a base. There's a 4th side. And that's your structure. The base is your structure. And that's the home of chiropractic and exercise and massage and posture and bones and muscles and ligaments. That's your structure. That can fix any problem. Just Google spinal pain and anxiety. And when the pain calms down, the anxiety calms down, right? Just Google it. So that's the base of the triangle. Then one side is the biochemistry, and that's where most of us spend our time, in the biochemistry, whether it's pharmaceutical or nutraceutical. That's where we spend our time. The next side is the spiritual or emotional side, and that's where the work of trauma release comes into play. And the last side is electromagnetic, for all the electromagnetic pollution that we have. So when you're suffering, when your body's not functioning the way you want it to, you have to look at all 4 sides. And usually there's one side that's primary, usually, but sometimes not. There's just a couple of sides that are contributing equally. And this talk today is about the spiritual, emotional side, that energy that circulates inside of us from our experiences earlier in life. So it's not the end all be all by itself. Sometimes it makes such dramatic results. Your autoimmune disease is gone when you're working on your trauma work. Sometimes it's just better because you also have to deal with the biochemistry and change your diet or whatever it should be. But that's how this fits into play, what you're hearing here today. Critically important component. And Amal asked the question. It's really a good question. In the science of hair tissue mineral analysis, it's the iron to copper ratio and the manganese to zinc ratio that show deep trauma patterns in a client. These ratios reflect trauma all the way back to childhood with 100% accuracy. I didn't know this. So this informs the way we supplement a client. Outside of this science, is there a way you supplement a person who is retracing a trauma response in their body? I realize shifting our bodies is a multi-pronged approach, and that proper facilitation by a professional can offer some external stability to help with the process. Really good question. And before Dr. Aimee answers, I'll just say the one thing about supplements that can help, absolutely helps, is the concept that 14 of the 15 top causes of death are chronic inflammatory diseases. It's always inflammation. So you have to identify where's the inflammation coming from. And Amal, you know this, you're a CGP, you know this, but for everyone else, where is the inflammation coming from? And so you can supplement to reduce inflammation, like turmeric, vitamin D. There's a number of supplements you could use, but you always have to look at lifestyle and say, where is the inflammation coming from? Now, from that perspective, Dr. Aimee, how would you respond to Amal?
This is a huge topic, actually. And one of the aspects that we've not had time to go into today is actually how our biology can predispose us to experiencing trauma. And when we look at what is trauma and trauma being that response of our body, it's because our body, our nervous system specifically, didn't feel safe. It didn't have the support. It didn't have what we call the regulation that it needs. And what are all the factors that go into regulation? Well, yes, actually the copper levels do factor in for the regulation of our nervous system. Zinc levels, actually, when you look at zinc levels have one of the highest associations with mental health disorders. So that zinc deficiency, it seems to be a big factor in causing the nervous system to just be more sensitive and more raw. And Dr. Tom, you've seen this, right? Like people, their bodies can just be so sensitive to everything, it seems. And so when we are more sensitive, we will also be more sensitive to experiencing trauma because we get overwhelmed more quickly. Anything that overwhelms us, even if that overwhelm is coming from a inflammation or an infection, it doesn't matter the source of the overwhelm, whether it's biochemical, biological, or emotional, it's still an overwhelm for the nervous system. So when we look at these biochemical imbalances, yes, like that is a huge aspect of even Dr. Tom was talking about the foundation, right? Like that can be the foundation for our system. And how resilient is it versus how sensitive is it? And whether it's resilient because it's resourced with magnesium and zinc and the right dosages of copper and manganese and all of these things that we need in our body, if it's resourced because it has the right dosages and amounts, our body is so resilient. Like it can go through so much and we don't experience it as an overwhelm. We don't experience that shutdown. It's when we have imbalances, and I've identified 3 most common biochemical imbalances that seem to be causing us to be predisposed to trauma. But it's this idea that yes, like our biochemical imbalances, our nutrient deficiencies are actually creating the structure to be weak. And a person is going into a situation already vulnerable, and that vulnerability leads to them experiencing something as trauma. Whereas if they were resourced on a cellular level with all of these biochemical nutrients and minerals and vitamins, if we were resourced, we would be able to handle so much more in life and actually not experience trauma.
Marvelous. Marvelous. Stanley from Zoom is back. And he says from the earlier question, he's the combat veteran, 100% disabled. He said, I have some hypertension to go with my diagnosis of Gulf War illness, autoimmune issues diagnosed by the VA War-Related Illness and Injury Study Center. Trauma may indeed be triggering my issues, but how can you know for sure? Avoidance of anything toxic was my chief protocol. Okay, Stanley, you're already on the right track. Learning what might be toxic to your body and what's not. Way to go, man. Way to go. That's a start. Dr. Aimee, where does Stanley go from here? Besides, and I'll make this comment, Stanley, you might want to be working with Dr. Aimee directly. You certainly want to do her master class here and just learn little bits and pieces with every session and be putting it together and implement some of this stuff. But Dr. Aimee, where else would Stanley go from here?
This is what I hear from a lot of people, Dr. Tom. So Stanley, you're not alone in this. And many people aren't just like, they don't know. They don't know if I have stored trauma. They don't know if it's contributing to my physical health. They just don't know. And so that's actually the place to start, is what I call, we need to go on a journey into your nervous system, Stanley. We actually need to go on a journey and just see like what's there, what's showing up, because even if it didn't cause it, it would be contributing to the persistence of symptoms and diseases. And at this point, it doesn't matter if trauma's there, like it needs to be resolved so that it's not contributing to our physical health. And so this is where I make the invitation to you and other people who are in the similar situation. Like, we just need to go on a journey. There's no way that we can know this for sure studying about it, talking about it, analyzing it. At the end of the day, it's still just theory, because we actually have to go on a journey into your nervous system. That is my 21-day journey. That's why I designed that program for just this situation of actually safely, very safely going on a journey into our nervous system to just discover how much trauma actually do I have.
Marvelous. Thank you for that. Kevin on Facebook says, Dr. Tom, it's Kevin, North Wales. Hi, Kevin. How are you? I'm good. Thank you, Kevin. I'm going for chemo in a bladder cancer on Thursday. Any tips, please? Well, the first thing is to live an anti-inflammatory life. Make sure you're not eating garbage. We just did a webinar earlier today, my partner and I at Sunhorse Energy, and we were talking about a particular product called Cell Protect, and the kinds of testimonials that come in that oncologists say this is just magnifying the benefits of whether they're doing chemo or radiation, but people are responding so well and so quickly healing from the toxic side effects of the treatment. The oncologists are blown away. Kevin, we did a webinar where we elaborated on that, and there were some bladder cancer cases with Dr. Ryan Sternagel, and it's called the Stern Method. If you Google him and the Stern Method, you'll find the webinar we did about, or maybe Ann can post it here if she has the link, and watch that webinar. It was an hour where we were talking about exactly what you're going through and what to do for it. But Dr. Aimee, would you have any points for Kevin, who is going through chemo on Thursday?
It brings to mind a story from my audience. Her name was Melanie. I actually put her story into my very first podcast episode that I published. So you can hear her story on the Biology of Trauma podcast. It was a podcast episode with Dr. Peter Levine, and I interwove her story into it. But she was going through chemo or radiation, one of the two, for breast cancer at the time. She was actually going through my 21-day journey at the time that she was going through these cancer treatments. And what she described in her story that was so helpful for her, that changed everything for her, was her ability to what we call orient to safety in the room. So that as she's coming into the room, she's, again, like shifting her own state. We talked about the importance of being able to learn how to shift her own state to one of gratitude and openness and safety. And that's what she was very intentional about. She was able to use some exercises that she had from my 21-day journey to be able to do that. But I would encourage you to do the same, is find some way to feel safe. And a lot of times orienting around your environment, making sure that you see everything, you know what's going on, so that you can be telling your body, right here, right now, we're safe. Right here, right now, we're safe, so that your body can even be open and receptive to the treatment and not be guarded and closed off. But you
critically important, Kevin, critically important. Can you imagine having gratitude for chemo? Yes, that's exactly what you need, because if you've chosen to do this treatment, this is not a poison for you. This is something that's there to help you. It's got side effects and you can minimize those. Watch the webinar we did on the product called Cell Protect and you'll be blown away. But to go into the session with gratitude, and to actually go out of your way, maybe to be kind to the nurses and the doctors there, like say, boy, I'm so grateful that you're here and we're doing this because I know this is going to help. They're like, yeah, all right. And you empower them to be grateful that you're here. So it's a great, great concept. Thank you, Dr. Aimee, for that one. Thank you. Well, we've gone over the hour. Once again, it just goes by so fast. Everyone, the link is here for Dr. Aimee's Biology of Trauma 3.0. Please click on the link, register for it. You might listen to one session, you might listen to many, and it's your choice, but it's all free to watch. So click on it and pick up a few pearls that might actually change the quality of your life. Dr. Aimee, thank you so much for being here today.
Absolutely, Dr. Tom. Anything, anytime for you.
Thank you so much.